So good evening, and this is the first session.
Okay.
So according to our syllabus only, we are going to cover all the topics. And if anybody need the syllabus, then I hope I already shared it, or else you can download it from Career Fountain website. Okay, so
Okay.
today, uh, first topic is what kind of types of insurance plans are available in the market, and we are already aware with so many things.
Okay.
Okay,
Uh,
we can compare with Indian healthcare. Like if you want any kind of insurance policy or the plan, then so many insurance companies are there in the market and they are selling these kind of plans. If you want coverages for your healthcare services, then you have to take a plan for healthcare. If you want to save any money for long term and after 10 year, 15 year, 20 year, you'll get the bulk amount. You can save the taxes. Then people are taking general insurances. Dental plans are for covering the dental services. Security insurance plans are for if you are keeping any expensive things in the locker or the bank, then that time we used to take that security insurance. Fire
okay.
insurance, especially for the warehouses, because
Uh-huh.
bulk, so many things are there in the warehouse. So that time fire insurance will be there. And the
Okay.
auto insurance we are already aware about. Like if you are taking any bike or car, then it is mandatory for us to take
Uh,
this insurance.
yes.
Traveling insurance is the part of your ticket only. If you
Uh,
are
uh,
using any airline or any train, then it's a
mm,
part of your ticket only, right? So
yeah.
these are the plans, and now we are going to focus on US healthcare. So in US also, these kind of plans are there in the market, sold by different companies, and we have to focus only on the healthcare plans. If you are working for dental client, then you have to focus on dental plan. The patient should have the dental insurance, then only it will cover the dental services. If you are working for any multi-specialist hospital, then the healthcare plan should be there. Other insurances will not work. If any accident happen with the patient, then he should have the auto insurance. Then only it will cover the accident related services. Okay, so these are the type of insurances available, and at this point, we are not aware. Like we don't know for which company or for which client we are going to join. Okay, and which specialty we are going to join. But there is no need to worry about that because for any specialty, we are our work is not going to change. Okay, so if we already know what is meant by neurologist who are providing service related to the uh, brain. Okay, cardiologist for the heart, pediatrics are for the children's, general physicians or the internal medicines are the or family doctors generally who are only degree holders and providing the basic services. Gynecologists are specially for the female related issues, and then dentists for dental services, and the anesthesiologists specially are available in major surgeries where anesthesia are required, and orthopedic are for bone related services. So these are some specialties. Some more specialties are also there, and if you are working for any multi speciality hospital, then all the specialists are available under the single roof. Okay. So sometimes maybe possible that you got the client and they are only orthopedic. So all the claims are related to the orthopedic services only. Okay. So depend. If the client is big, then definitely it will be a multi-specialist hospital. Okay. So in US, many things are many rules has been created by US government and everybody have to follow. In India, every insurance company is having their own claim form and they are having their own rules and regulations. Okay, but in US, some rules are created by US government and everybody have to follow. So they have created or segregated this billing part into two things. One is the hospital billing, another is the physician billing. These are the main two billings. So hospital billing means hospital related charges are there. So in India, if you are going to the hospital or family or any friend is getting admitted for any reason, Then at last we'll get one single bill, and under that single bill, all the charges are there, right? ICU charges, room charges, doctor charges, or any lab charges, right? Or any specialist visited, then that charges. So all the things are under the single bill. But in US, hospital charges are different, and the doctor's fees charges are different, called as physician bill. So here, if you are working for hospital charges, that means you are going to work for hospital billing. And there is a different claim form for hospital billing called as UB04. Okay, so in our next 30 days, we are going to focus on physician billing because more openings are there for the physician billing. And even though we have taken a training for physician billing, definitely we can apply for hospital billing openings as well, and they will consider our profile because they knows that you have the knowledge about the basic process. So definitely, if they provide you at least 15-20 days or 1 month training for hospital billing, then you are able to work in that process as well. Okay, so we'll see how it look like and all, but just at this point remember, for hospital charges there will be a UB04 form. It will have the almost 84 boxes. Okay, if I want to show, then can show you sample UB04 claim form. Okay, so like this, we can easily find out. Okay, you don't have to worry. No, if you are telling that you don't have any knowledge or the experience about the UB04, okay, you just only know that it is used for the hospital charges. That is more than enough. Nobody will ask you any question on it. Okay, because this is also parallelly, this is also vast. How much time we are taking to learn about the physician billing, to learn about the hospital billing also, it will take that much time. Okay, so almost it is having how many boxes? Let me check. So almost 81 boxes are there for the UB04. Okay,
Mm-hmm.
and you don't have to worry about it. We are going to focus on the CMS 1500 form.
Okay.
Okay.
And this hospital billing, it's sorry, physician billing. It is only in US healthcare.
Yes, we just have to think about the US healthcare. Okay, so
Okay.
physician
Okay.
billing is nothing but whatever claim form or the charges we are sending to the insurance, that is related to the doctor fees only,
Okay.
not for the any hospital charges. Like even though patient has taken any services for the hospital, like he has used the ICU room or maybe the room or maybe a wheelchair or any other thing related to the hospital charges, for that there will be a different claim form. Okay, but
Okay.
if we are talking about the physician billing, that means whatever claim form we are sending, that is only for the doctor charges to provide that service.
Okay. Okay.
So we are going to focus on CMS 1500 form. That means the physician billing we are going
Physician
to learn.
billing. Okay.
And for physician billing only, so many openings are there. There is a reason actually. Hospital charges are too high. Like every claim is about 10,000, $20,000,
Mm.
and our client don't want to take any risk with big bills. So that's the reason they are not outsourcing the hospital charges, so hospital billing. But physician billing, it start with $200, 300, 400, 500, maximum $6,000, 7,000 are the charges for bills. We can see. Okay, not more than 10,000. I never saw any bill for the physician billing which is more than 10,000. Okay, so that's the reason. Volume is more for the physician billing. So they used to means outsource it to the Indian companies. Okay, so this is the CMS 1500 form. We will have the separate session for it to understand each and everything in very detail, because every day we are going to open this claim form at least 30 to 40 times. Whatever claims you are working, every time we are going to open this claim form. Okay, so we should have a good knowledge on the CMS 1500 form, and there will be a random questions in every interview. They will ask you the randomly some important boxes from the CMS 1500 form. So there are total 33 boxes, but we don't have to mug up or remember all 33 boxes. Only 12 or 13 boxes are there which are important, and I'll give you the notes, and in that notes, the important boxes are also there. Okay, so whatever we covered, if you are going through the material that much, that is also more than enough. Okay, you don't have to worry about other part. Okay, so how we are going to send this claim form to insurance? Multiple ways are there to send the claim form to insurance. First of all, claim form is nothing but the bill, whatever we have provided service to the patient. Okay, we cannot send 50, 60 pages of medical record for each and every bill, and insurance also don't have that much time to go through the 50, 60 pages to understand what service has been provided to the patient, and then decide the payment. So that's the reason we are sending only single page claim form, that is the CMS 1500 form. Okay, and how we are sending to the insurance, that is also important, right? So multiple ways are there to submit our claim form to the patient's insurance company. Okay, so first is the electronic way. It is the preferred way. That means it is the fastest way. If you are sending today, then today only the insurance will receive our claim form. So how we can send this claim form to insurance? Electronically. Okay, that is also main thing. So if you want to send an email, electronic mail, so what is the important thing? You should have the correct email address, right? Sample USC ID insurance card. So how we are going to send the electronic claim form? For that, we should have the ID card, and on that ID card you can see here there will be a electronic payer ID. That means the 5-digit code is there. You can see here payer ID. Okay, so this is the importance 87726. If we are using this payer ID while billing our claim to insurance, through electronically, then that claim will go to the correct insurance. If any small digit change is there in our application and we are expecting that it will go to the correct insurance, then it will not happen. So to send claim through electronically, we should have a electronic payer ID for that insurance, and each and every insurance is having a electronic payer ID. So all the payers, that means all the doctors, hospitals, whenever they are using any kind of application and if they are sending a claim form through electronically, then every billing department have to make sure that they are using the correct payer ID. Okay, so I'll show you how it look like in the system. Okay, in uh, different application different screens are there. Okay, but in our application we'll try to understand where we can see the payer ID. If any small change is there, like one digit is changed as per the ID card, some other electronic payer ID is given, so it is our responsibility to update that in our system, and accordingly we have to bill again. Otherwise it will go to the wrong insurance if any small change is there. Okay, so I'll show you. It will take maybe 2-3 minutes.
Okay.
So next is the paper claim. So paper claim means uh, through courier company we are going to send the claim to insurance, and we should have the address of the insurance, correct address. Then only our physical claim form will go through the courier company, and we are not responsible for that. Only we are doing from the application. We are taking just action. Okay, as a AR, if I am working here and I want to send claim to the insurance. So as I said, there are multiple ways. So example, if I am working on one claim here, okay. So you can see here, patient is having multiple insurances. Okay, and if you go inside to the insurance, you can see here, uh, electronic payer is there, right? So in the payer ID field, if this is not matching with the ID card, then it will not go to the correct insurance. So it is our responsibility. This number should be matched with the insurance ID card. Okay, so mhm. So ID card will be available in the system itself. We just have to open that ID card. It look like this. Okay, it look like this, and we just have to check the payer ID is mentioned on the ID card and in our system is matching or not.
Okay.
And that is the way if we want to send claim through electronically. If we want to send claim through paper, that means the whatever address is given in the system that should be matched with the ID card. So in ID card, backside of the ID card, okay, there is a address where we can send claim form. So you can see here, this is also sample ID card.
Okay.
And on the ID card, on every insurance ID card at backside, we can see the insurance claim mailing address. Okay, claim mailing address means where we can send the claim. That is nothing but the claim mailing address. So we also have some more details like the provider. That means phone number is available. You can see here for the provider. This is the website. This is the phone number which we can use. This is the medical claim where we have to send for Georgia. Okay. So like this, we can get the more detail. And this is the electronic payer ID, and some more information is there like what kind of plan it is, member name, or how many dependents or the beneficiaries are there under the same plan. Is it a group plan or the single plan? Okay. What kind of means plan name is also there. Okay, these are the details we can see on each and every insurance ID. Like 500 plus insurances are available, so we don't have to worry about that. Don't worry. Next is the paper claim. So, as I already said, if we want to send claim through paper, generally we used to prefer to send the claim through electronically. But if any insurance is saying that they need claim through paper, they are not accepting through electronically.
Mm.
So it is our responsibility whenever we are billing our claim. Okay, if you want to bill a claim through paper, example, I want to resubmit this to Cigna, then you will get such kind of option whether we want to send it through electronic or paper. So if I'm selecting here paper, then it will get printed in our hospital. Okay, there is a printer and the blank pages is nothing but the blank claim forms are there,
Mm.
and it will get printed and somebody is responsible to send that on given address through courier company.
Okay. Okay.
This is the way how we can submit a paper claim form from our system.
Mm.
Okay, so you
Okay.
can see the Cigna via paper we build it. Okay, so now you come to know means understood like how we are sending electronically or the paper. Right.
Yes. Yes.
Next is the fax. So if
Uh,
we are having fax number of the insurance, then we can send it through fax. So some insurance company are accepting claim form through fax as well.
mm.
Consider that we already submitted multiple times our claim form to insurance through electronically or maybe paper, but they are not receiving our claim due to any technical reason or anything. So this time you don't want to take a risk, so you can request them, can we send through fax? And if they're saying yes, you can send claim form through fax, then we just have to ask them the fax number. And nowadays there is no fax machine actually. It is a electronic fax only. So it is same like the Google Mail, how we are using the Gmail. It is same like, but if we are sending the email, then we are using the email address. If we want to send the fax, then we instead of entering the email address, we just have to enter the given fax number. That's it. Okay, so we can send a claim form through fax. And fourth way is some insurance are having this facility on their website itself. So we can upload the claim form on the insurance website. Okay, so these are the four ways, and most preferred way is the electronic way. Okay. Yes, you can remember.
Yes. Yes. Yes.
Next is
Uh, my son.
yeah, you can mute, no issue.
Thank you.
So next is what if insurance has received our claim and they want to process, they already processed the claim and they want to pay to the provider. Provider means nothing but the doctor or the hospital. So they want to pay to the doctor. So how they are paying to the doctor? So there are also three ways how insurances are paying to the doctor. First way is the electronic fund transfer. This is the preferred way and the fastest and the secure way. So there will be some process. If any provider or the doctor want his payment from insurance company through electronically, then he have to do some paperwork with each and every insurance. Maybe it will take 3-4 months. Maybe it will take minimum 1 month at least to do that process. And once we enroll for the electronic payment, then in future each and every payment will receive through electronically. If the if that enrollment or the paperwork is not done with the insurance company for the electronic fund transfer, Then insurance company used to create a paper check and they are sending through courier company on our hospital address. Okay, that is the next way how the doctors are getting payment from insurance. Third is the virtual credit card. So this is a very rare actually, like 0.2 or 0.3% only out of 100. Okay, so virtual credit card means like 10-year, 15-year back, if you remember how we are hmm, recharging our mobile. So there is a scratch card. We used to scratch the card. We are getting that number. We are dialing that number, and the amount will get credited as a talk time. Right. So same here, virtual credit card number will come to the authorized person in the hospital, and that number, that person is using that one-time usable number. If insurance want to pay 10,000, then only $10,000 is there under the virtual credit card. And if somebody is using that number, then that amount will get credited into the bank account. That's the virtual credit card. It's a rare actually, but yes, out of 500 claim in one or two claims, we can see that insurance has paid through virtual credit card. Okay, so these are the three ways, and most preferred is the electronic fund transfer. Okay, paper check can go anywhere. Okay, we can see that courier company can send it to the wrong address as well, or maybe our correct address is not available in the insurance system. So the secure way is the electronic fund transfer. It will not go to the wrong account and all. Okay, wrong address also. It will come. And paper check are slow actually. If insurance is sending, maybe it will take 15-20 days to receive that check. After receiving also, if we are submitting into the bank, okay, then again bank is also taking 2-3 days to process that check, right? So most preferred is the EFT. Within a minute, amount will get credited into the bank account. So whenever insurance has processed the claim, I'm not saying that every time if they process the claim they will pay. No. So might be possible that after processing the claim, they will deny the claim. They will partially pay the claim. They will apply to the patient responsibility. They will keep that claim in pending status. Okay, anything can be happen with the claim. But whenever they are processing the claim, they used to generate one claim number. They used to generate one receipt. That receipt is called as explanation of benefit. Okay, so we can see that okay how it look like and all. Okay, that explanation of benefit is nothing but the receipt from the insurance company. Okay, so I'll show you how it look like. Sample EOB. So I have downloaded some EOBs from the insurance web portal. Okay, so every insurance company is having little bit different format, but the main columns or the main values or the information will be same. So this kind of receipt insurance is going to create. So we'll have the separate session to understand how to read the EOB, how to analyze the EOB, how to take the action on the basis of EOB. EOB is nothing but the receipt. After processing the claim, they used to generate one this kind of receipt. Okay, and it will be available on the insurance website, and we can also request on the call itself if it is not available. So if claim process, definitely it is available on the insurance website. We can download that from the insurance website. Okay, so that is nothing but the EOB. So here two more names are there for the EOB. One is the explanation of benefit or the explanation of payment. So if they are sending that receipt through courier company, that means through it is the paper EOB, hard copy of the EOB. If they are sending through the courier company on our hospital address, then it is called as explanation of benefit or the explanation of payment. But if they are sending that receipt through electronic way, how how we are sending claim form through electronically, the same thing they are sending electronic version of EOB through electronically, and it will receive in our application, not directly in our application. There is a mediator application called as EDR. We'll try to understand that as well, but at this point just remember ERA means nothing but the electronic version of EOB. Okay, it is nothing but the receipt after processing the claim. So you can see here, this is the sample EOB. Okay, so we'll try to understand here, not today, but there will be a separate session to understand each and every box. Okay, because for each and every uh, claim, we are not going to call. Okay, so let me open the notes. This is the part one. I'll send you the notes as well. Don't worry. Okay, so
Okay.
yeah, so there are total 5 parts of notes. Okay, whatever
Hmm.
we covered accordingly, I'll share one by one. You can print as well. Okay, so there nothing is there outside of our notes. Okay, so what is the
Okay.
US healthcare? So the US healthcare system is the mix of public and private healthcare services. That means in US also private hospitals are there obviously, and the government hospitals are also there. It includes
Okay.
hospital, clinic, doctor, nurse, healthcare insurance company. Everybody is a part of US healthcare system. Okay,
Hmm.
so
Hmm.
there are 4 main components of the US healthcare. One is the
Hmm.
provider. Provider is nothing but the doctor. Okay,
Hmm.
person or the facility which is providing the healthcare services called as provider.
Hmm.
Payer means nothing but the insurance company. Patient
Hmm.
means nothing but who is taking service. Okay,
Hmm.
and the regulator means the US government offices who are deciding some rules and regulation for the
Hmm.
healthcare. Example, in our India, for
Hmm.
all the banks, they have to follow the rules created by the RBI, right?
Hmm.
So
Yeah.
here in US, each and every healthcare service provider and the insurances, they have to follow the guidelines which is created by these US government agencies or the department like the CMS, FDA, CDC, AMA. We are going to see that in detail. Don't worry. Even though at
Okay.
this point you don't know the long form and all, you don't have
Hmm.
to worry. So insurance plan, as I already mentioned, specialties also I already mentioned. Okay. So this is the physician bills and the hospital bills. Okay, you can go through the notes and how the electronic claim form is going. So this is the preferred way, right? Electronic way. So how it is going? So this is the application which we are using. Okay, as I showed. Okay, from our application, we are just resubmitted claim from our system, but it is not directly going to the insurance actually. There is a mediator application we are using. Why we are using that also I'll explain you. Example. Okay, consider that we are working for one hospital, and obviously there is a one billing application called as practice management system. Okay, so we are using one application called as PMS. Okay, PMS at billing department of provider. From provider, we are using one application, and here is the insurance company. Every patient is having different insurance. Okay, we
Okay.
cannot expect all the patient is having the same insurance. So 500 plus insurance companies are there. So what will happen if any patient is coming to our system, means our hospital, then we will provide him a service, and then patient will just submit his insurance ID card copy or the photo, and he will leave. He is not going to pay anything. It is 100% hospital responsibility, doctor responsibility to reach or to deal with the insurance, patient's insurance. Okay, so maybe it is a USC, maybe it is a BCBS, maybe it is a Medicare. Like this, so many insurances are there. Okay, so from our software, if we are sending claim form to directly to the insurance, what will happen? If we are sending today, okay, maybe electronically, maybe paper. So we are talking about the electronically. So it will reach today only. Okay, so one day
Hmm.
gone, every insurance company is using or maybe taking a standard processing time to process the claim. So maybe they have taken 3 to 15 days. So we'll consider maximum 15 days they have taken to process the claim. and consider that after processing the claim, they found that some mandatory information is missing on the claim form. So they have denied the claim. Next time, what we did, according to the denial, again we have rebuilt the claim.
Okay.
Okay, maybe we received the EOB after 15 days. Okay, and then we have work on that claim again after 1 week. Again we sent. Again insurance has taken 15 days, and again they have denied. Like the information is there, but it is a wrong information. Okay, so
Okay.
because of these kind of things, small issues, our doctor is not getting payment. It is getting late, but our hospital doctor, they are expecting the payment should receive as soon as possible because they already provided service to the patient, right? So this is not the correct way how we are sending our claim form to insurance. Okay, so what we are doing, we are using one mediator application between our software and the insurance. So that mediator software is called as EDI software, electronic data interchange, also called as clearinghouse. Okay, so here we are sending our claim form from our software. It is going to the EDI application, and in EDI application, the main role for the clearinghouse or the EDI is check the claim form. All the mandatory boxes are filled or not, the format is correct or not. It will catch the small mistakes. Okay, instead of sending any error claim form to the insurance, we can use the EDI application. Everybody is using actually. Okay, so we are using this EDI application to check the claim form. So that checking claim form is called as scrubbing the claim.
Is
Okay,
it is it a tool, EDI
it is the
clearinghouse?
application software. Okay.
Okay.
It is the third party application which is providing service to all the practice management software. And as I said, 500 plus practice management softwares are there in the market. Like that, EDI applications are also there. So many EDI applications are also there. And as a any kind of PMS can take a service from any kind of clearinghouse. Their work is just to check the claim form is correct or not. Any missing information is there, then that claim form will not go to next level. It will just stuck here. So we are having different team which is working on those claims which are stuck into the EDI or the clearinghouse. Okay.
Okay.
So
It is checked. It is not checked by manually, no?
no, manually it is not checking.
In the
Automatically,
application, it is going to check.
yes, some rules are set
Okay.
into the application,
Ah.
and the application is checking whole claim.
Okay.
Okay, for each and everything. And if any small mistake is there, then that claim will stuck into our EDI only. That is called as
Okay.
internal rejection. So there is a separate team who is working in day shift. They just have to
Okay.
go to the EDI. They are logging into the EDI. They are checking how many claims got rejected, and they are trying to understand each and every rejection reason, and accordingly they are fixing that, and they are
Okay.
then resubmit the claim from the EDI to the insurance.
Okay.
Now insurers are also receiving thousands of claims from different provider every day. So they also don't want to accept the wrong claim form. So what they are doing, they are also taking a service from one of the EDI application. So whenever any provider is billing claim form, first of all it will go to EDI from the PMS. Then from the provider EDI, it will go to the insurance side EDI. If whatever rules has been set by the insurance, if everything is correct, then only that claim will go to the insurance claims department. Okay, and if they process the claim and if they're sending us a receipt through electronically, so that electronic remittance advice or the electronic version of EOB, insurance is going to send it in our clearinghouse. Okay, and from our clearinghouse, anyhow, it is connected to the practice management software. With in one click, automatically it will get posted into the correct patient account. If 1,000 pages are there under the ERA, then also automatically in one click, all 1,000 patients' data is getting posted into the correct patient account. Okay, so that's the ERA, electronic remittance advice. So this is the process how the insurance we are sending claim form to the insurance through electronically. And to send this, we should have the electronic payer ID. Okay. So I hope you understood the process how the claim form is going to the insurance. And this is the backend process. Actually, we are not seeing that how it is going and all. We are just selecting in our system. I want to build the claim to particular insurance, so I am just submitting it from my application. I'm just taking the as a yeah. Okay, resubmit the corrected claim example. I did some correction and resubmitting the claim. So in our application, we can see that okay, claim is resubmitted, but actually it will go to the another application, and we will have that access as well. So we can see that whether it is reached to the EDI or not. Definitely, it will be there. Okay, and we can see whether it is accepted, rejected. Okay, those things also statuses we can see in the EDI. Okay, so this much you understood.
Yes, yes,
So these ways I already covered. Okay,
yes.
EFT also these are the payment ways. Uh,
Uh-huh.
these are the receipt. Okay,
Hmm.
this is the sample EOB.
Hmm.
What is the pros and cons for the US healthcare? So pros means what? Advanced technologies. Everybody is using the application for
Hmm.
long time. They can keep the patient record, histories, right? Everything they can maintain for the patient. But the cons is that everybody is using the technology. These many departments are there, and these practice management software or the EDA application, they are not free of cost. If you are talking
Hmm.
about the practice management software, minimum $300 to $1,000, $2,000 per user per month. There is a rent, right? So that's the reason we have generated for training purpose internally. Okay, because if consider that a big client is there and they need 1,000 licenses, 1,000 people are using that application, so they need thousand licenses. So every month they have to give the money 1,000 into $500. Example, this much revenue they have to pay to the software company every month.
Hmm.
So for so these companies are also earning big revenue every month from so many clients, right? So if the big client is there, what they are doing, they also want to save the money for long term. So they are generating their own application, right? They are developing their own application. Maybe it will take 3 year, 5 year to develop the perfect application. There are some rules and regulation, and then only they can use that application, right? Because as I said, for all over US, there will be a same claim form, right? So this claim form, this kind of claim form is there, and from any application, claim form should go like this only. And each and every claim form is the unique claim form. You can see here barcode is there, so we cannot use the same claim form again and again. Okay, so
So every insurance company is having different claim forms, no?
no. Every insurance company don't have any insurance, don't have any claim form actually. They have to accept this claim form only, which is designed by NUCC, National Uniform Claim Committee.
Okay,
Okay, so the
then the claim form will be same for all the insurance company.
claim form is same, but each and every claim form is the unique claim form. Unique means what? If I am having example, if I am having another example, I can say like
Okay, okay. Whatever the in the claim form, whatever the data is given, that will be different.
yeah, definitely that will be different. But example,
So,
I have this paper claim form.
uh,
If I am taking a color printout of this 10, so I cannot use the same claim form for 10 different patients. Why? Because there is a barcode. That means there is a payment actually. Provider have to buy this claim form. Okay. So for a single paper claim form, 18 to $20 charges are there. For electronic claim form,
okay,
almost
okay.
$4 to $5 charges are there. So we cannot use the same claim form for multiple patients.
Okay, for claim form also they are charging.
Yes.
Uh,
Nothing is free actually. Okay. You can
uh-huh.
see in upcoming sessions, everything is means any patient is using any wheelchair in the hospital for 2 hours. For that also they are charging.
Uh,
Okay, so it is very expensive in US. Okay,
uh-huh.
all the services are very expensive. In India, we bless actually. Till now, for us it is expensive nowadays, but compared to US, it is good actually. Okay, so if we
Uh-huh.
want, I want to do any root canal for one tooth, maximum 10 to 15,000 are enough in India
Uh,
anywhere.
Uh-huh.
But in US, the charges for doing root canal for one tooth, it will be 2 to 3 lakh.
Oh, is it?
2,000 to $3,000 charges are there. So if you are converting that, it will convert it into the 2 to 3 lakh rupees.
Oh,
So that much expensive things are there. So
yeah,
you
too
come to
much
know that.
expensive it is.
Yes, so that's the reason. If don't anybody don't have insurance now, it is very hard for them to survive there. If they are getting any government insurance, that is good and well. Otherwise, they used to take help from any charity or any charity hospital where they can get a service in free of cost. Okay, some
Mm.
camps are also there. You can see such kind of videos in YouTube. So many poor people are there. They don't have the policy. They maybe they don't have that correct document, and also that is also one of the reasons they're not getting insurance from the government as well. So such kind of people, if they want any kind of service, then they have to wait a long time for their number to get the
Yes,
service
yes.
free of cost.
Yeah, yeah,
Okay.
yeah. And what I have heard here, immediately we can meet the doctor if we go to the hospital. But there, we need at least 1 week, like that. It seems.
Even though here, if especially for the childrens below 15 year, if you are reaching to the pediatric, then suddenly they will check and they will give us a prescription.
Yes,
Everything
yes.
they used to give that time itself. But in US, they are just checking the patient. If it is not serious, they are just checking, and you just have to go, and they are just charging for checking it. So 3 to 4 times they will just check only. They are not, if it is not serious, they are not giving any single tablet or anything. Okay, especially for the childrens.
Oh.
Okay. So many good rules are also there and bad rules are also there. So we are going to see in upcoming sessions. So this is one of the
Okay.
pro that
Okay.
everybody is using the technology, but the cons is high cost, and this is also affecting the bills actually. Like doctor have to pay this much amount to the software companies, right?
Hmm. Hmm.
So
Hmm.
so that is the reason for the end user, nothing but the patient, the bill is getting increased, right? Another pro is provider choice, like patient can go anywhere in India. If you are having healthcare insurance, then you will get the list of hospitals and you have to go to that hospital only. Otherwise, you will not get any cashless policy, right?
Hmm.
But
Hmm.
in US, it is not like that. You can
Hmm.
go anywhere, and it is 100% doctor's responsibility to deal with your insurance, whether they are contracted or non-contracted. Okay, high quality care compared to India. Definitely, they are now giving or using the technologies. Means giving more attention to each and every patient, not like India. Okay,
Hmm. Hmm.
so the facilities are very good compared to any other country in US. Okay,
Hmm.
and the complex billing.
Hmm.
Cons is complex billing. Like these many departments are there.
Hmm.
In every hospital, they have to maintain these many departments. How many departments are there? Almost 13 departments are there in the RCM cycle. Okay, so
Hmm.
complex billing, because of this, everybody have to go through these stages only. Then only claim form will go to the insurance, right? So this is nothing but the complex billing. In India, if you are having claim form as a policy holder, we can also fill that. Okay, easily, right?
Hmm.
But in US, so many things are there, like that service needs to be converted into the coding, some codes and all, right? So for that, there is a certified coders team is also there. Okay, so this, because of all these regulations, billing is getting complex. Okay, so this is the cons. Okay, so what I'll do, I'll share you the notes. I'm as per the syllabus only. We used to take sessions. Okay, so in first session, whatever I want to cover, I have already covered. Okay, we can go through the notes. It will not take much time. For at least 1 week, we are going to whatever topics we are going to cover. For you, it will take only 15-20 minutes to go through the notes. Okay. And then after 2 weeks, whenever we are going in deeper topics, then maybe it will take more time for you to revise each and everything again and again. Okay.
Okay. Okay.
I'll
Okay.
stop here. And